These videos will be about an essential and important device in a clinical laboratory department. This device is a clinical chemistry analyzer. This part will be an introduction about a clinical chemistry analyzer, and this introduction will cover the following points. The first point will be a general definition for a clinical chemistry laboratory. Then we will talk about the common analytes and combination of tests, or also known as panels or profiles. Then we will talk about the clinical chemistry analyzer. We'll have firstly a definition for a clinical chemistry analyzer. Then we will talk about the measurement principles, steps in a pre-analytic phase, steps in analytic phase, facilities requirements, classification schemes, and finally major manufacturers. What is a clinical chemistry laboratory? Clinical chemistry tests measure concentrations or activities of biologically important substances called analytes. These analytes can be ions, molecules, or complexes in a various body fluids such as whole blood, plasma, serum, urine, and cerebrospinal fluid. The results obtained from such measurements are compared to biological reference intervals or medical decision levels to provide diagnostic and clinical meaning for the values for physicians and other staff. Common analytes could be ion, salts, and minerals, or small organic molecules such as metabolites, therapeutic drugs, toxicology, drugs of abuse, or it could be large macromolecules such as transport proteins, enzymes, specific proteins, lipoproteins, diabetes marker such as the hemoglobin A1C or also known HbA1c. Most of the analytes need serum sample to be analyzed. In the case of the HbA1c, we need the whole blood. The rupture of the RBC will be done using a device called vortex matrix in order to be able to measure the HbA1c. When an individual test alone is not sufficient to assess a medical condition, then a combination of several tests may be used. Such combination is known as a panel or profile. We have typical panels or profiles. We have a basic metabolic panel. We have a lipid profile. We have electrolyte panel. We have heptic panel. We have a comprehensive metabolic profile. So as we said, the panels or profiles are used to assess the condition of a specific organ or system. For example, we have panels for heart diseases, we have panel for liver, we have panels for to assess the condition of the kidneys, we have a panel to assess the condition of the pancreas, and so on. So usually a physician will request a panel or a profile, depends on the case or condition of the patient in order to assess the medical condition for this patient. So a clinical chemistry analyzer is used to measure these analytes. As we can see here, a photo for a commercial clinical chemistry analyzer, which is manufactured by Beckman Coulter. The model is AU680. Now we will watch a small video for the work of a clinical chemistry analyzer AU400, which is manufactured by Beckman. So I will play again this video. We can see here the aspiration of the sample by the sample probe, and the dispensing in the cuvettes or the reaction cells in the photometer. We also can see the movement for the reagent probe, which aspirates the reagents. Depends. Sometimes we have we use one reagent. Sometimes, mostly, we use two type of reagents, R1 and R2. Also, we can see the mixer, and here's the photo for the photometer, which is used in is used to measure the analytes in the serum. The measurement principles for the clinical chemistry analyzer, we have two types of the principle. We have optical one and electrochemical one. The optical one is photometry, which is based on the measurement of the absorption made by the analytes by analytes. We have the potentiometry, which is also used to measure certain analytes. So these are the principles, and the photometry will be covered in a separate video or part. As we said before, we have a pre-analytic phase. We have steps in the pre-analytic phase in order to obtain a specific type of sample which will be used in the analysis of the analytes by the clinical chemistry analyzer. This type of sample mostly will be the serum. We have only one exception, which is in the case of diabetes, when we need to measure the HB1AC, the hemoglobin A1C, which needs a whole blood. So in order to obtain a serum sample, we need to follow these steps in the pre-analytic phase. The question, as we said before, why we need why we cannot measure directly the analytes in a blood sample, in a venous blood sample or arterial blood sample directly, because the presence of the blood cells and coagulation protein will lead to the scattering of the light and consequently inability to measure the analytes absorbedness, which is needed to calculate or to measure the value of the concentration of these analytes. These are the steps in the pre-analytic phase. As we can see, firstly, a venous blood sample will be drawn from a patient using a vacutainer with a gold top, which contains a clot activator and a gel, which is a physical barrier will be the physical barrier between the serum and the blood cells. We will wait about 30 minutes in order to this coagulation to take place. Then the sample will be centrifuged for 10 minutes. Finally, we'll have the serum will be separated from the rest of the blood cells and the coagulation factors by this physical barrier, which is the gel. Then a part of this sample will be aspirated in order to be analyzed using a clinical chemistry analyzer. This is an example for the pre-analytic phase for the clinical chemistry analyzer. These are the steps which are made automatically by the automated chemistry analyzer. We will show firstly the system checkup will be made, self checkup will be made for the different parts or components of this analyzer. Then a calibration will be done. Then a quality control check will be done. Finally, the sample analysis will be made. The calibration and quality control and the sample have the same steps, which will be from the step number 6 till the number 10. However, the difference will be the added material. For example, we have, as we said, calibration first, then the quality control. Finally, we'll start the measurement of the patient samples. In the calibration, firstly, we'll add a reagent using a reagent probe. Then we will make a mixing for this reagent and we'll incubate it at 37 degree. Then a calibrator will be added, also will be mixed and incubated. And finally, we'll measure the absorption of the light, which will be made by the final product as a result of the reaction between the reagent and the calibrator. This similarly will be the quality control, which will be used to check up or to verify that the calibration was done successfully. And after the verification of the results, we can now start the measurement of analytes in the patient sample. As we said, the calibration, quality control, and patients have the same steps as the 6 steps. Okay, but the only difference will be either a calibrator or a control or a patient sample will be used. So reagent will be added, mixed, incubated, then either a calibrator, control, or a sample will be added. The final then will a mixing will be done and incubation at a 37 degree, and finally the measurement will be done. Why we need a calibration, why we need a quality control, and the steps in each one will be covered in a separate part. Now I will talk about the facilities requirement for a clinical chemistry analyzer, or to install a clinical chemistry analyzer, or to work properly in a laboratory department. First requirement for the clinical chemistry analyzer will be the water quality. We need deionized water, which is free of bacteria. Also, we need to provide the connection with the hospital information system via the laboratory information system. The current standard format for the data communication between the analyzers and the his system or the hospital information system is the HL7. This is the standard format. Another requirement will be a separate drainage. Also a power supply, an interrupted power supply or UPS also will be needed. Also a certain temperature, humidity, and atmospheric pressure or pressure is needed. The preferable temperature will be 21 to avoid the high temperature, which could causes some problems for the work of this analyzer. Also, the pressure should be a normal or a neutral pressure. Another point, each analyzer has a specific amount of water which is needed to be provided. For example, in case of the clinical chemistry analyzer, which is provided by the Beckman Coulter, the EU400, a 20 liter per hour is needed for this analyzer to work properly. Now we'll talk about the classification schemes for the clinical chemistry analyzer. We have different types of classification schemes. The first classification scheme will be the automation level, either standalone or modular type. Standalone is used where no automation is needed, whereas the modular type will be used in the case of a total laboratory automation or partially laboratory automation. I will give an example, two types of or two models of analyzer which are manufactured by Roche. The first analyzer will be the Cobas C311 analyzer. The second one will be the Cobas C501 module, which also manufactured by Roche. The Cobas C300 analyzer, 311 analyzer is a standalone which usually used in a small laboratory where no automation is needed, whereas the Cobas C501 is used in either the case of a partially or totally laboratory automation. Another type of classification scheme is will be the load size. We can classify the clinical chemistry analyzer either small, medium, large, or very large, depends on the load size. We'll have also the same type of analyzers or models which are manufactured by Roche. The Cobas C311 will have a maximum load size which will be 480 tests per hour, which is considered small load size, whereas the Cobas C501 will have a load size about maximum load size, which will be 1000 tests per hour, which is considered as a medium load size. Another way for the classification of clinical chemistry analyzer based on the reagent type used. It could be either dry or wet. Most or major of the analyzer use the wet reagents, as we can see here, the bottles. Most of them use liquid type or wet type of the reagent, liquid reagents, whereas also we have the dry reagents, which are used also by another type of clinical chemistry, but the majority of them will use the liquid reagent. We can see here the major manufacturers for clinical chemistry analyzers. The main difference between these manufacturers, between those manufacturers, the ability to manufacture different size. As we said, one of the classification for the clinical chemistry is the load size. For example, we have Beckman Coulter, we have the Roche and the Siemens. They have all the load sizes for clinical chemistry analyzers, whereas other manufacturers, they have either one or two types of load size for a clinical chemistry analyzer. For example, Medica, they have the clinical chemistry analyzer EZRA, which is used for small laboratories. Now, as we said, the measurement principle for the clinical chemistry analyzer will be either a photometry, which is the measurement of light absorption, or a potentiometry, which are based on the electrochemical potential. As we have seen before, that most of the analytes cannot be measured directly. Also, a point should be mentioned that we measure each analyte, or the analyte with the reagent will form a final product. This final product will absorb a specific wavelength. So we have what we call a monochromatic filter, which is needed to measure the concentration of an analyte in serum. So most of the analytes cannot be measured directly at a specific wavelength. Instead, we add reagents. For this, we need reagents to form another product. This product will be absorbed light intensity at a specific wavelength, usually a monochromatic. Most of the clinical chemistry analyzer are monochromatic, and we have some exceptions which are biochromatic, and we will discuss this in the photometer part of the lecture of the series, which covering the clinical chemistry analyzers. As we can see here, this is a model manufactured by Beckman Coulter. This is the EU480. We can see here the photometer, which uses the principle, the measurement of light absorption in order to measure the concentration of analytes in a serum. Here, the part which is related to the potentiometry principle, potentiometric principle, which is used to measure ion selective using ISE electrodes or ion selective electrodes. This is the same photo for the above analyzer. We can see here the photometer. Here is two photos for this photometer. We can see here the cuvettes, which are a reusable type. We can see here the lamp and the light here, and here is the photometer. We can see here the cooling liquid, which is used to reduce the surrounding heat which is generated by the lamp to avoid the quick damage for this lamp. Also, we see here the photo for this cuvette or reaction cell. This is a reusable type. Where we have also another type of cuvette of reaction, which is semi-reusable or even could be disposable. Here is the part which is related to ISE module, the ion selective electrode module, which is used to measure the sodium, potassium, and chloride. Finally, thank you.